Right, Gaurav, that is on.
Namaste and good afternoon. This is Dr. Srinidhi Chidambaram and welcome to this FB Live session presented by Apollo Hospitals. I'm very happy to see all of you again. Quality of life is the degree to which an individual is healthy, comfortable, and is able to participate in or enjoy life events. Quality of life can be affected by any disease, even non-fatal or non-serious diseases can impact quality of life, causing pain, disability, or immobility, and
I'm
keep
not responsible.
from enjoying life to the fullest. To help you get rid of such health issues, Apollo Hospitals the series
Huh.
in which we will be discussing every week the latest technologies, innovations, and path-making treatments for you to obtain freedom from diseases and conditions that are hindering your good health. Today, we are going to discuss a very, very common health issue that many have, and that is back pain. Back pain can affect people of any age for different reasons. As people get older, the chances of developing lower back pain increases due to factors like degeneration. Lower back pain may be linked to the bony lumbar spine, discs between the vertebrae, ligaments, cords, nerves, lower back muscles, even the abdominal and pelvic internal organs. Back pain can also result from everyday activities or poor posture while working, and many other reasons. Treating back pain needs investigations to find out the cause of the problem, and this would be followed by treatment. Dr. Alok Ranjan, one of the most senior neurosurgeons in the country and in the Apollo Hospitals group as well, is here today with us to discuss back pain and how to obtain freedom from back pain with minimally invasive therapy. Dr. Alok Ranjan, with experience of over 30 years, is one of the earliest practitioners of minimally invasive spine surgery in this country. He established, in fact, the Department of Minimally Invasive Image Guided and Robotic Assisted Spine Surgery at Apollo Hospitals, Hyderabad. He is the senior consultant and coordinator of the Department of Neurosurgery at Apollo Hospitals, Jubilee Hills, Hyderabad. He was a registrar neurosurgery at the Morriston Hospital, Swansea, and later a consultant there, and also a faculty member of the Department of Neurosurgery at CMC Vellore. He regularly conducts instructional courses in minimally invasive disc surgery, minimally invasive spinal fusion, disc arthroplasty, and balloon kyphoplasty in several workshops, and has performed more than 9,000 major neurosurgical operations since 1999 at Apollo Hospitals, Hyderabad. Welcome, Dr. Alok Ranjan. Thank you very much for joining our Facebook Live session, and we look forward to hearing from you how people can obtain freedom from back pain.
Thank you, Dr. Srinidhi, for the lovely introduction. Your first statement was the quality of life. And every individual aspires to have a good quality of life. A simple thing like back pain can be the biggest killer of a quality of life because we use it every moment in 24 hours of the day. Back then, when I started my neurosurgical practice, back pain was a problem of late middle-aged people. Today, back pain is a problem of young age. Early 20s, late 20s, these are the commonest people who come with back pain. So, the most, or rather the commonest cause of back pain is a degeneration of the lumbar spine. And in that, there are a lot of categories of conditions. And the commonest for a layman's language is degenerative lumbar spine and disc prolapse. But why should it happen? What made it such a common problem that practically 3 out of 5 people between the age of 30 and 40 suffer from this? sometime or other. It is mainly to do with the lifestyle. There are lots of causes of back pain other than degenerative spine. You can have a tumor, you can have an infection. As you rightly pointed out, that the back, that spine of the back is surrounded by lots of other organs, muscles, abdominal structures, pancreas, kidney. So a lot of things surrounding can cause, but 99 out of 100, it is the spine itself which is the cause of back pain. The spine is designed in such a way that when we sit, the spine pressure on the disc is nearly 4 times more than when we stand. So sitting is a bad activity. And in today's world, sitting is what we do.
Yes.
Especially with IT sector, digital media and all these related where we need to sit, back is the killer. Now, how to treat? The most important part of treatment is to prevent. If you don't have it, you don't need to treat it. Because when you have it, then you go through a loop of treatment which may make you satisfied or dissatisfied. So I will first concentrate on prevention.
Yes.
Prevention is understanding that you are not immortal. Your body is a machine. It needs to be serviced properly. It needs to be run properly. It needs to be rested properly. And for that, every individual should have a physical activity which strengthens the core muscles of the lumbar spine. Because if that is not there, nothing in the world is going to make you happy, surgery or no surgery. So understanding this, that we must have our postures correctly placed. We should not be sitting for a long time. We should not be adding weight to our spine. And what adds weight to our spine? Obesity. Then again, we come down to activity. So the activity to strengthen the core muscles of the spine and the general fitness, physical or mental, is very, very important. Probably, at least in Western country, swimming was a part of curriculum for every individual. Every student had to have swimming. That was a part of curriculum. Unfortunately, in India, sports, forget about swimming, no sports activity is a curriculum. It is a luxury which some people indulge in, and is a necessity some people indulge in. But it's not a common denominator in our life. So once is a how to keep your body fit. There is a muscle in the body, in the lumbar spine. We never bother about this muscle. It's a small, small muscle between the spine. And first time we came to know that this is a muscle which needs to be very active to keep the disc space from collapsing, to keep your spine more erect. So we always thought the muscle is to contract something, but this muscle is to distract something. So as we understand more and more, we realize that it is possible to preserve your spine for a much longer time. Physical activity, swimming, improper use of posture, bad chairs, especially when I see my own child and when they are doing these online classes, I know that we have a disaster in the making.
Yeah.
We all have, we can't do. And at that age, you don't realize, but that when the habit gets in and the spine starts aging faster than it should, by the time it is a bit too late. Then comes, other than strengthening and all these posture correction, then comes the need of treatment. Let us assume that 95-98% of back pain is a benign pathology of the spine, such as degeneration which happens with age or use or misuse of the spine. As we understood that how to prevent misuse, how to have good use is also very important. Once you get a back pain, there are some red flag signs. We must not assume that every back pain is something very benign. It may happen in 2 or 3% patient, But if we miss the boat there, the consequences are very high. So if you have a back pain of something very unnatural, never had that kind of back pain, which especially has come without any activity, a back pain associated with high fever, a back pain with other symptoms related to abdomen, related to passing urine, related to vomiting and things like that, which may suggest some other system. Generally speaking, a back pain does not happen when you lie down. Actually, you feel better. But spinal tumor within the spinal cord or outside the spinal cord in the spine are very notorious to have back pain when you lie down. And then we think, why should he? This is such an unnatural thing. Why should you have too much pain when you lie down? But that is how the classical history is. So anything other than ordinary back pain should be investigated. It's better to consult a specialist who can examine you, because today another problem has been added in our system: online consultation. But the online does not allow you to touch the patient and examine the patient. Where is a painful muscle? Are we feeling something different? Is there any swelling in the back? So we must not discount examination. It's very important examination. It's also very important to have cross questioning. Remember, all pain is more painful when your mind is not correct. When you are in a very happy state of mind, a lot of pain subsides. So mind also is very, very important. Are we going through some physical, mental trauma, which is aggravating our problem? Because it's our own body, everything is important. So any red flag signs like high fever, severe pain in certain posture, any weakness, numbness of the legs, not able to walk properly, difficulty in passing urine, motion, immediately you must consult a specialist. And today's investigation is so different and so easy. You do an MRI scan, which is available in a village also, and you get a rough idea what you're dealing with. It doesn't mean that everyone should have an MRI scan and X-ray, but a right candidate. Then comes, if you diagnose something, then what do you do? So once you have ruled out a major cause of concern, red flag, and we limit ourselves to degenerative spine. If we find patient has got no deficit, it is just a pain in the back or the leg, which is limiting the patient's activity, aggravated by certain postures, certain activities, not responding to simple pain medications, then we need to examine these patients and see whether they have any neurological problem. If they have none, once again, a course of physiotherapy where muscle relaxation exercises are done and a medication will help. But if that does not help, or if the patient already has a neurological problem like numbness, weakness, then we must investigate. Remember, if you investigate 100 patients, nearly 90 to 95 will not require surgery. There's only 5 to 10 will require surgery. And it's also very important in back not to do unnecessary surgery. Because anyone on the roadside, including an auto wala, will tell you, oh, don't have a spine surgery done. It's because you have seen enough patient with unnecessary spine surgery and its consequences. So once you have diagnosed that, yes, when do we need surgery for a disc? For a common person, pain only is not an indication for disc surgery. Pain in the back only is definitely not an indication for disc surgery. So unless you have a pain, shooting pain down the leg, which is not responding to medication for nearly 6 weeks, or a shooting pain in the leg with some nerve damage, weakness, numbness, there is no indication for surgery in the disc, barring a few exceptional situations. Rules are not made for exceptions. Exceptions are otherwise. Then comes, once you have diagnosed it, then how do you tackle? Suppose you decide to do a surgery. Now, spine traditionally we operate from the back, but there are situations where we operate from the sides also, and uncommonly from the front also. Basically, we are looking for two scenarios: spine, which is stable, and spine, which is not stable. Spine, which is stable, which is based on certain investigations like dynamic X-rays and even MRI, CT scan, with a disc collapse, are treated with a very minimally invasive technique. Spine, which are unstable with all these things problem, are treated with a minimally invasive fixation technique. End of the word, key word is minimally invasive. And in my view, it is not about instruments. In my view, it is about the attitude of the surgeon to damage as little tissue as possible so that the core component of the spine is stable. The longest lasting fusion of the spine is your own bone fusion. No implant is going to give you fusion beyond 9 months and 1 year. If the spine itself has to give you fusion without an internal fusion of the bone, it means surgery has failed. So what has technology helped us? The technology has, apart from diagnostics, technology has helped us in finding the least damaging route by which we do surgery. By we remove a disc, the amount of disc we remove, the way we do stabilization of the spine without damaging the muscles, without damaging the area of the spine above and below the area of surgery, without giving a big cut on the spine, without losing blood. All these things come to minimally invasive surgery. Now, it is like seeing a room without entering the room. So you need a good camera. You need a good optics to see the room without entering the room. So minimally invasive surgery is all about understanding the inside without entering the inside. Diagnostics will help you. Optics will help you. And knowing exactly what to do will certainly help you. Spine surgery, we hear open surgery, small surgery, big surgery. End of the day, the role of every surgery is to take away the pathology which is causing you the pain. Most of the time, the pathology which is causing you a pain, a typical disc collapse, is less than 5 by 5 millimeter. So you're talking of a centimeter of a space where you need to operate. But to operate that centimeter of the space, 30 years back, we were exposing 10 centimeter of the spine. Today, what we have learned, that actually we can operate 3 square centimeter through 1 square centimeter incision, because it is about the inside, not the outside. So minimally invasive surgery has benefited with technology. This is one branch which has benefited with technology, because how do we get the precise location? Of course, earlier days we used to use various kind of X-rays. Now we have what is called navigation. And in navigation, you have several types of navigation: O-arm assisted navigation, robotic assisted navigation. Basically, an artificial intelligence based on your imaging pre-operatively is telling you which point to reach and how to reach, which corridor to take to reach, so that there's a minimal damage. That's all the theory of machines don't matter. It is the concept which matters. I have seen and done minimally invasive surgery without any costly equipments with a minimum cut, because you know what access, how to go there. So it's not about only instruments. Of course, instruments help you vastly. It's about the concept and thinking. So we can actually come to a world where we can fix a spine, 2 spine, 3 spine. We can remove disc, we can put a cage, we can correct the deformity through one cut or several small cut. So what is the advantage of doing these things? When you feel that your optics is taking you right to the pathology, you don't need to unnecessarily expose the vast area of tissue. And whenever you remove the vast area of the tissue, you actually take away the nerve and the blood supply of that muscle. So if you will have a general experience, you had a cut on the arm in your childhood, and then you see there's a scar and there is a wasting. Because the movement that nerve and the blood supply of that muscle goes, that muscle is not healthy anymore. So our job is to keep the healthy and tackle the problem. That's all is minimally invasive surgery. Apollo has been very, very big pioneer in this. Way back in 2001, we were one of the couple of centers in the country where we invested minimally invasive disc surgery. Since then, in every big Apollo center, we have some kind of navigation to do minimally access surgery, fixation. And routinely now, those days, patients used to be in a hospital for 4 days, 5 days. Today is a daycare. And I'll give you a typical example. My kidney transplant surgeon, 5 years back, had a severe pain with some weakness. Of course, a transplant surgeon is little bound by the kidney availability. And he had a case planned 7 days later. We operated on him in the morning. In the evening, he insisted on going home. And 7 days later, he did the surgery on a patient standing 5 hours. This is all possible because diagnostic and doing the job without damaging the healthy tissue, which is called minimally access surgery.
So, Doctor, we do have some questions from our viewers who are watching this program. So I'll read them out. It's coming to me on the live feed, so I'll read them out one by one. The first one is the disc bulge or a slip disc, as we call it, is it reversible?
So disc is a central part. In between the two vertebral body, there's a padding. So there's a central part which is relatively liquidy, and the outer part is a relatively solid. When we say solid and liquid, they are all solid only. It's not like a jam and a butter, but relative consistency. So disc actually is 90%, 95% water when we are born. And by the time we age, it starts losing water. So if the outer covering of the disc, that is called annulus, is intact and there's a disc bulge, these disc bulges are reversible in a lot of situations because it's still not come out through that container. But once it comes out through the container, it may shrink in size, but it will not generally go back.
How realistic is it that a person could return to work after spinal fusion? I assume return to work within a week or whatever.
Yeah. So in today's world, when for every job there are 10 job seekers, not only it is important for the person body, but it's for his mind also to know that he can go back to his work. 9 out, in a general rule, in a good hand with a good selection of cases, 85% patients who go through these surgeries, they go back to their work within 1 to 2 weeks, if not earlier. 5% patients, or approximately 10% patients, 5 to 10% patients, they have multiple other associated problems or something not very right with the surgery that they will require a longer period of rehabilitation. And it's a 5% of the patient who may have some or other kind of complication. But now after 30 years of old practice, if I have to, patient asks me, will I get paralyzed? So I'll say your chance of getting paralyzed is the same as your chance of becoming Prime Minister of this country. Very small chance, it is there, but small chance.
How to get a permanent freedom from lumbago?
So lumbago is a pain, is a word for distribution of the pain in the lumbar spine going to the leg. And the extension of the word which everyone knows is called sciatica. So if it is in the sciatic nerve, which is S1 distribution, we call sciatica. And theoretically speaking, if it is an L3, L4, L5 distribution, we call lumbago. So it is a combination of lumbago sciatica. As I said, 95% patients will, with the lifestyle changes, good physiotherapy, short-term medication, and precaution, can live a relatively normal life.
How long is the post-operative recovery? Will I have to wear a neck brace, I assume, after minimally invasive surgery?
So neck brace is for neck disc, cervical disc prolapse. Now, cervical disc prolapse are also two types of disc. In some cases, we don't inhibit the movement, and in some cases, we inhibit the movement. Even the cases where we just fix the spine, the present screw and plate systems are very, very robust. So we don't give them very rigid collar. We give them a soft collar when they are moving around. And when they are lying, having a dinner and lunch and at home, we don't insist that they must have it. But traveling time, you must have it for the simple reason that in travel, high speed, if you have an accident, which is not your fault, someone else's fault, the neck will move very fast. It's called whiplash. And that can affect you theoretically. So brace, even for back and the neck, is now in 99% cases is not extremely rigid. It gives you mobility.
The last question is, when can I drive or travel after surgery?
After this surgery, you can drive in 2 days, 3 days time. Who stops you? But you have to think back. It is not about driving. It is about the road on which you have no control. It is about the suspension of your car on which you have no control. Have they contributed to your back problem? If yes, then you are going to again give the same causative factor. So you got to be careful of that. But driving as such is like going to a toilet. You are going to toilet, you will go in the same day. What is the big deal?
Absolutely. So thank you so much, Dr. Alok Ranjan, for illuminating the whole aspect of back pain. And I think it is very important what you said that, like apart from the surgery is the very last option and prevention is really the best way. So I do hope that our viewers would have gotten the message, and let's do what we can to prevent back pain. But do not live with the annoyance and irritation of back pain. Do get it investigated and treated so that you can be flexible, fit, and active once again. Viewers, thank you. Thank you for joining us. Please subscribe to our YouTube channel also to get the latest updates on trending healthcare topics. We'll meet again on the 19th of August at 2 p.m. and we're going to discuss freedom from cancer with the latest therapies of proton therapy, tomotherapy, and TrueBeam. And this is going to be discussed by Dr. Vijay Anand Reddy, Senior Oncologist from Apollo Hospitals, Hyderabad. And till we meet again, goodbye, stay safe, stay healthy. See you soon, and namaste.
Thank you, Dr. Srinidhi. It was nice.
Thank you, Doctor. Thank you.